So thank you to everyone for joining us today. This is actually the third part of a webinar series that we have that's focused on medical students, where our first session talked about an introduction to radiation oncology. Second session was about how to navigate the different oncologic careers and had some leaders from each surg-onc, med-onc, and rad-onc talking about why they chose their respective specialty. And then this third part is you've sealed the deal and chosen the best oncologic specialty, radiation oncology. And so how should you get ready for your away rotations? And so the format that we're going to have, we have Dr. James Murphy from UCSD. We have Dr. Kim Corbin from Mayo Clinic, and we have Dr. Jennifer Matsui from Ohio State College of Medicine, who is a recent graduate. So congratulations to her. To give a little bio for each of our panelists today. And kind of before we start the webinar, we're actually under a tornado warning and thunderstorm warning here in Houston. So if I disappear, the webinar will carry on and I'll find a way to log back in. Okay. So first of all, we have Dr. Murphy. He received his Bachelor of Science in Applied Mathematics from Columbia University before earning his medical degree from the University of Michigan. He completed his residency at Stanford University and also earned a Master's of Science in Epidemiology from Stanford as well. He is currently a professor at UCSD, where he focuses on treating GI cancers, but also has numerous other interests and leadership roles, and served as the co-director for the Center for Health Equity, Education, and Research. And some of his many roles in medical education have included assistant vice chair for education and training within his department. And within the medical school, he serves as an academic community director and the associate dean for assessment, evaluation, education, and informatics, which I think is why there are so many amazing medical students that go into radiation oncology from UCSD, which is wonderful. And he's an excellent clinical educator, has won numerous awards in education, teaching, and mentoring from Aero and UCSD. And he's also a leader in the field of health services research. He has his own research lab and founded a fascinating program that I recently learned more about from Dr. Munt on Optimus, the outcome program to inspire minority and underrepresented students. So that is Dr. Murphy. And I'll give our introductions for Dr. Corbin and Dr. Matsui at the end, but Dr. Murphy is going to kick us off talking about how you choose which away rotations to apply for, how you can prepare for them along the way. And this is, Dr. Murphy will lead the discussion, but if at the end, Dr. Corbin and Dr. Matsui have any thoughts, feel free to add those as well. So Dr. Murphy, thank you for joining us tonight.
Absolutely. Thank you for the very kind introduction. And it's an absolute honor to present to this group. It was unfortunately several years ago when I applied to radiation oncology, but a lot of it's actually still the same. I think we're having the same debates about the benefits of away rotations that we had 20 years ago. I'm going to go ahead and share my screen. I had just a few slides to present, partially just to keep me on track here. So first of all, when we think about away rotations, I think it's good to just probably lay out the potential goals. So taking a little bit of a step back, not even whether, like, which institution we should go to, but should you be doing an away rotation at all? And I think before you're going to answer that question, really try to help just lay out the goals. So number one, I think probably everybody's first goal for an away rotation is that, ideally this is going to help you match. And number two, this also is going to help you potentially figure out if an individual institution or the city is a good fit for you. I think another reason that people are going to do away rotations, if we're being completely honest, is that you can just go and spend some time in a different location. And I've been involved with the education mechanism here at UCSD for quite a long time now. We've had a ton of people come in that have no intention of going to our program, but they just want to spend some time in San Diego. And that's completely fine. And we're more than happy to have people come and join us. Number four, I think this is one of those other sorts of reasons that people will use. It'll show that you're willing to move away from your home institution. I think a lot of people, they start in one location, they go to undergraduate there, they go to medical school there, and they feel this need to demonstrate that they're willing to leave whatever environment that they're in. And then finally, number five is that if you are in a program where you don't have a home radiation oncology department, it's almost necessary, almost obligatory that you're going to do an away rotation. That probably goes without saying, but you have to have demonstrated that you have that commitment to your specialty. So before we go on, I'm going to go ahead and challenge some of these goals. And so the two that I'm going to challenge are number one, is this actually going to help you match? And number four, is this really going to show that you're willing to move away from your home institution? And so, as been kind of discussed, I'm one of the associate deans here at the institution. I do a lot of random things, but one of the things that I do at UCSD is I'm the person that actually collects a ton of data across all specialties for everybody who matches at our institution and try to really look at the patterns of how people are matching, whether or not away rotations are helping or how they're swaying things. And so some of what I'm going to share is really just my experience in this role. Not always related to radiation oncology, but we've had a lot of students going to radiation oncology, so I'll also share that as well. So number one, do away rotations help you match? So it turns out that this is actually a pretty difficult question to answer. People have tried to do research in this area, and there's absolutely a correlation between doing an away rotation at an institution, getting an interview there, and then eventually matching there. But there's a tremendous amount of selection bias if you think about this. If you're going to do an away rotation at an institution, that's probably where you want to go. It's a harder question to answer of whether or not this is really helping your chances at that institution. So I think we need to take a step back and just say that, quite honestly, all these away rotations are going to be audition rotations. And if you have a good audition and you have a good performance, it's going to increase the odds that you're going to match at a program. If you don't perform well, it's going to decrease the odds that you're going to match in the program. And one of my roles here at UCSD is I specifically work with individual students in my community. And so I have tons of students that do away rotations. And I can think of many examples where students are going to do an away rotation and they actually don't get an interview at that program. And that's just how the process works. And there are some students, if I'm being completely honest, probably would have done better if they hadn't done an away rotation at that institution. And so this becomes a really complicated dance that you're playing when you start to think about the benefits of doing an away rotation. And from my perspective, I think it's best to be very strategic about whether or not you're going to do an away rotation. Think about your odds of getting an interview at this program with and without a rotation, or not just getting an interview. Think about your odds of matching at an individual institution with or without an away rotation. Now, this is going to be a very personal decision. There are going to be a lot of factors that are going to flow into this, but I think it's good to be honest before you set down this path of actually doing an away rotation. So the next thing I want to kind of challenge or push is this whole question of, do away rotations show that you're willing to move away from your home institution? And so, a few years ago, this was just kind of gospel in radiation oncology, is that, for example, people in California had to go to the other coast so that they would demonstrate that they're willing to live on the other coast, or had to go to the Midwest to be competitive with Midwest institutions. So there are clear regional trends with respect to who's getting interview and who's matching at different institutions in different regions of the country. There's no doubt about that. We've shown that here, and that if you're in the state of California going to UCSD, you are much more likely to get an interview at UCSD or at California institutions than you are compared to East Coast institutions. And the same is true at other locations as well. That's been clearly demonstrated. So this whole concept of, do you need to do an away rotation? This a couple of years ago was the standard answer. It's yes, you had to show that you're going to go somewhere else. But now with geographic preferencing and program signaling coming into the mix, this question got a whole lot more complicated. And so it's really hard for us to say that you really need to do an away rotation at this point to just show that you're willing to live somewhere else. So program signaling, I'm sure a lot of the people on this call are very familiar with. This is new to radiation oncology this upcoming year. Now, applicants in radiation oncology will have up to 4 program signals. Other specialties have done this for 2 and 3 years. And so when we look across the aisle at other people, there's a lot of experience in how these program signals have kind of really changed the whole game. And so in other specialties, when you look at surveys of residency program directors and even raw data from ERIS, and even when we look at our own experience here at UCSD, these signals really are transformative. They really do shift the whole dynamic of how people are applying to residency, where they're getting interviews. And it is one of these sorts of things where I think ERIS is saying this is good for our student applicants. I don't know if I completely agree with that, but nonetheless, this is the game that we're playing now. And when you look at individual specialties, signal distribution amongst different programs is extremely skewed. And we don't have data for radiation oncology. And so this is actually a plot I stole from another specialty. But in most other specialties, there's a big clustering of signals at a few programs at one end of the spectrum. And so 25% of programs receive around 50% or more of signals. And so when you guys are thinking about, and I know, apologize for going a little bit off topic here, but I think this is a really important point. When you're thinking about your signals, you need to be really thoughtful with where you're applying your signals. And this will kind of tie back into where you're going to do away rotations and how, again, this whole game is played. And so in select specialties, program signaling really does impact whether and where you're going to match. From my perspective, and I don't have data to support this, I think in radiation oncology, with the number of signals we have, looking at the other specialties that only have like 3, 4, or 5 signals, I don't think the signaling is going to be absolutely critical to determine whether you're going to match, but I do think it's probably going to start to shape the landscape in terms of where people get interviews and ultimately probably where you match. And so that's something to think about with your own advisors and just kind of ruminate on as you're going through this process. So this kind of comes back to the question of what is the added value of not of an interview, I'm sorry, what is the added value of an away rotation, a little bit of a typo on my slide, in the era of program signaling in geographic preferencing? So from my perspective, I think this is an open question. I think on one hand, we could all argue that to show your true love for a residency program, you should be doing an away rotation there, using a program signal and putting your geographic preference right over that region of the country. But on the other hand, you could probably also argue that a program signal in a geographic preference very well might be sufficient to get a program's attention. Now, I don't think we entirely know the answer to this question. This is something that's going to probably be teased out in the next couple of years once people start to look at their data. But nonetheless, these are things that I know a lot of our applicants are thinking about. So let's think a little bit about timing of an away elective. This is something that happens every year. I met with a student about an hour ago talking about timing of away electives. And so this is a very common question. When we think about our, every fourth year at every institution is going to be a little bit different in terms of the calendar, but this is a relatively, straightforward thing. A lot of our fourth years are going to start around May and then kind of extend throughout the year. ERIS is due on September 25th. And so I know that technically you can submit this late as an applicant, but you should not do this as an applicant. I know that technically programs can look at ERIS applications after the due date, but a lot of programs will not look at any application that comes in after the due date. And so definitely as an applicant, you're most certainly going to want to get this in on September 25th. I've looked across our institutions and your odds of getting interviewed drop by 85% if you submit even one day late to the ERIS portal. And so you definitely want to be on time in terms of your submission. The interview season in radiation oncology, maybe late October, November, all the way through January, maybe early February. And then finally, your rank list is due on March 5th. And so when we think about when to do an away elective, there's kind of a couple of different timeframes that we can think about. So one, these green months up here, this is when your away elective will very likely make it onto your ERIS application. And so if you're going to do it May, June, July, or August, it's pretty high chance that that experience and probably the grade is going to make it into your residency application. Now, these yellow months are a little bit different. These are months where if you do the rotation in these months, you will make an impression on this away institution, but it probably won't make it onto your ERIS application. Now, that's not always a bad thing. This is something that I can't exactly prove. I don't have a lot of clear data to support this, but it's really hard to make an argument that doing an away rotation at one institution is going to really change your chances of getting an interview or matching another institution. To be frank, it can sometimes go against you. To be completely blunt, if an applicant is a really strong applicant and does an away rotation at UCLA, we're going to be honest and say, you know what, they want to go to UCLA. That's great. Why would we want to waste one of our interviews at UCSD on this applicant? Now, that's not exactly true. I'm no longer a residency program director, so I can't say that that's true. But nonetheless, you kind of get where I'm coming from, and that people can look at the pattern of your away rotations and say, oh, this person does this. They're just not going to be interested in my institution. So it's not a zero-sum game. There are some potential risks with doing away rotations. And then finally down here, I have these red months. This is just going to be too late. I know there's some anecdotes of people doing rotations in February and then all of a sudden magically matching at that institution. I'm sure that's happened, but that's going to be very, very infrequent in terms of from a timing perspective. January, you're starting to probably flirt with danger. Ideally, you probably want to do it a little bit earlier in these yellow months if you're going to do an away rotation kind of during the interview season. At some point, you're going to start to run into the classic interview season. There's going to be these conflicts. You're going to have to leave the rotation, which means you're probably not going to make it a good impression. But I do realize that a lot of institutions are pretty booked during the interview season. So sometimes you're just going to have to take what you can get. So Well, go ahead. I think that's actually all I had to present, and I'd like to thank you guys for your time. And I think we're going to have a panel later, so I'll take questions at that point.
Wonderful. Thank you so much, Dr. Murphy. Okay. So the next segment we're talking about is, you've applied for your away rotation, you've chosen your month for your away rotation. Now you are about to dive into your away rotation, and what should you do during that rotation to hopefully have a positive outcome and to learn what you need to learn. And so this is where we're going to have Dr. Corbin jump in and give her thoughts and advice about what to do during the actual rotation. And for a brief bio for her, Dr. Corbin earned her medical degree from the University of Rochester School of Medicine, and she then completed her radiation oncology training at University of Chicago, where she served as chief resident. And she currently works as an associate professor of radiation oncology at the Mayo Clinic in Rochester, Minnesota, where she focuses on treating patients with breast cancer. And she also currently serves as the National Consortium of Breast Centers co-chair of the Imaging Subcommittee. She has a strong interest in medical education as well, and she currently serves at Mayo's residency program director since 2020. She is an education committee member for the Radiation Oncology Education Collaborative Study Group, also known as ROCSIG, and she's also the chair of Mayo's Radiation Oncology Education Committee. And she's received numerous awards, including Minnesota Monthly Top Doctors Award and Teacher of the Year from the Radiation Oncology Residents as well. And so, Dr. Corbin, thank you so much for joining us. We're excited to hear your advice on what to do once you're there for your away rotation at said institution.
All right, so you can hear me? I shared with Stephanie and the other panelists that I didn't make any slides. I thought I would just kind of talk things through, but I decided to pay homage to one of our current residents who's gave his annual talk today on the use of AI in radiation oncology. He's one of our home and pathway residents, Dr. Dan Ebner, who's really an expert in this area. And I challenged myself to use ChatGPT to create a graphic, and the prompt that I gave it, let's see, I think I said to demonstrate visiting a medical student rotation engaged in clinic. And then I asked it to share with me to change the scene to be a radiation oncology scene. So I think kind of like all AI, it's sort of like one of those things where you start to look a little bit closer, you see some like the hands here and the hands here, and some of the graphic is a little bit funny, but it's pretty remarkable if you have the opportunity to kind of play around with some of the AI tools that are revolutionizing medicine in our field. So I'll leave this up for entertainment and, find the errors or something. Here's another one with the hands while I kind of chat. I am the program director at Mayo Clinic, and it's been like 4 years in that role. And I was an APD before that, but always engaged with medical students while I was here. Just because I had an interest in education. Some of the things that were not in the bio is that I actually was in private practice for a few years before returning to academic practice, in part because I really missed the learner environment and education. So I'm really fortunate to be in this role and happy to be kind of at the helm here at Mayo. I think I learned a lot from Jim's presentation, so I thank him for presenting that data, and excited to talk in the panelist role about that in the upcoming session, particularly about how to think about signaling. And there's a lot of the things that you said I could certainly relate to. When it comes to how to be successful in a rotation as a visiting student, part of me feels like there's not that much advice to give. It's really about trying to get the most out of the rotation, both from the performance perspective, like that audition role. So you want to present your best self to the program, but it's also about trying to get the information that you need to know about whether the program is a great fit for you. So Jim's advice in terms of really trying to potentially seek out places that you might want to think about training, I think is really sound, because it's really a dual it's a dual benefit in terms of the program gets to learn more about you, but you get to learn more about the program. So when in kind of thinking about what type of advice to give for the rotation, I think you could view it as kind of things to try to get out of the rotation in the clinic, and then things to try to get out of the experience overall that may not be directly related to the clinical experience. As a program director, a supervisor of medical students and residents, I would say the biggest thing that helps a medical student be successful on a clinical rotation is really engagement and enthusiasm. And I think that's going to sound kind of silly because, you know, we're all people who I think like to achieve, and we sort of think, well, I need to know everything about this patient or everything about this situation. But realistically, the people that you're working with understand your role as a medical student, and what they expect from you is to come to clinic prepared. So to have looked ahead to the patients that are coming forward, to demonstrate that engagement and enthusiasm, and then to bring that to kind of the tasks of the day. So most rotations, the ones that I went on as a senior resident or senior medical student, and the ones that we set up for students are really you're assigned to a faculty mentor. And so you're fitting into a team where you're going to be seeing patients and trying to understand the role of radiation therapy in their diagnosis. And so being able to understand the case, the patient that's in front of you, how to present that patient, and then to have demonstrated some kind of interest in trying to understand the role of radiation is really what I'm looking for. So it doesn't mean that you have to be right. In fact, it's, you know, we all know that that we can't expect that of anybody, even ourselves. We're always kind of modifying what's right for treatments. But I think demonstrating that you have taken the time to look up the information about the patient and to make sort of a projection about what might the treatment plan be for this patient and how might I recommend that is really a key consideration. I think outside of showing that enthusiasm, kind of or other ways to show that enthusiasm are to engage in any opportunities that come up. So participating in the didactics that are there, our visiting medical students are invited to those. And I think when they attend them, not only do you get that education, but you also get a sense for how our didactics given at the program. So is this a program that has a certain structure that aligns with what you're interested in, and it shows you're also engaged. I think other opportunities come up where we sort of offer to students to participate in, and if you're interested, it's great to take those up if you can. I think back to we had a visiting student, and I remember it's been like 3 years, but I remember because it was so remarkable, who was here on a weekend when I was on call working on the presentation, because we have our students give a presentation at the end. And, you know, we sort of exchanged pleasantries, and she said, oh, like, what are you doing here? And we had a cord compression to treat emergently. And she was like, hey, I'd really like to see that. So she sort of came along and came to the machine. And was the first time I could remember a visiting student kind of coming and doing an emergent treatment with us. And of course, her role was largely shadowing, but just demonstrating that interest was really, I think, pretty notable, or at least noteworthy, because here we are a few years later, and I remember that. So definitely, I think being prepared, being engaged, and being enthusiastic are kind of the key things that I would recommend. Ideally, the program that you're rotating at is going to also set expectations for you. They should give you a schedule, tell you who you're going to work with, and tell you what's expected of a visiting student who's there. So I mentioned that we expect our visiting students to give a short presentation at the end of the rotation. And that's an expectation that's outset at the beginning of the rotation. We sort of tell them, here's how students tend to use this time, but here's how, you know, you could use that time successfully. And then I meet with the visiting students during their first week and just touch base, make sure that they've gotten the information that they need, and also provide some advice to them about, you know, that they may want to touch base with the faculty member if they're presenting a case, and make sure that they kind of set themselves up to be successful. in our institution, when you give that presentation, it's not just in front of the residents, it's in front of the department faculty as well. So we set that expectation, and working with the faculty members and residents who kind of know what types of questions can come up can really help you to shine. So I definitely recommend using all of the resources at your disposal, which include the residents and the other team members. The other things that I take note of when we have a visiting student, again, this is all pretty anecdotal, but people who work well within the team, because we're such a team-based specialty. So when I see people who function really well with the residents in the department, that makes me sort of think about how they might fit in as a trainee. And I think about how they're interacting with our nursing team, our mid-level providers, our dosimetrists, and other folks too. So definitely, I think, demonstrating those types of skills is something that we like to see. Outside of the clinical performance, I think there's other kind of benefits and things that you should think about in an away rotation that might be valuable. One is just networking. So just getting to meet people who are also applying in radiation oncology. So networking with current trainees and visiting medical students, as well as faculty members. We have such a small field that the people that I rotated with as a visiting medical student, I still know from those times. So I graduated medical school in 2007, and I could tell you the names of the people that I did my rotations with, and they remain people that I relied on through the interview season. One of them actually was a University of Chicago medical student who helped me when I matched there, kind of find the right neighborhood to live in and other things. So networking, I think, is a really nice benefit. And then in terms of assessing the program, aside from personal networking, I think you can gain a lot of information about the culture of a program from being there and from attending the didactics and working with the faculty and kind of trying to make notes about those things. But it's also a good opportunity to visit the city to see where would you be living. Do they have the grocery stores that you like or that you can live with? And do they have the activities that you like? And to try to get involved in the cultural scene. Hopefully there'll be some opportunities for socializing outside of the clinical space where you can spend some time with the current trainees or kind of get a sense for what it would be like to actually be there. And I think all of those things can help make the rotation successful, both from the perspective of your performance clinically, but also your ability to assess the program. I guess the other thing I would say is that in general, I'm a big fan of feedback and transparency and giving and asking for feedback. So as a student, if you feel like there are certain things that you want to make sure the faculty are giving you feedback about, it's great to let them know ahead of time. And when I have the meeting with students who are rotating, we usually kind of talk about, are they planning to apply in radiation oncology? Because we have some students who aren't. And if they are, then we say, well, one of the goals of the rotation, especially if it's early and kind of that green zone that Dr. Murphy is talking about, is, acquiring a letter of recommendation or finding ways that this rotation can support your application. So then we talk about individually, like what are the things during the rotation that we might be able to do to support that. So now I've rambled a lot. Maybe I'll pause and we can move on to Jennifer and then get to the panel portion.
Dr. Corbin, thank you so much. You said some of those were anecdotal, but I think everything was a very highlight and good point. That is excellent content and advice for medical students. So thank you for sharing all of those amazing tips. Okay, last we have Dr. Jennifer Matsui. She just graduated from medical school at the Ohio State University College of Medicine. So congratulations. And before going to medical school, she went to UCLA for an undergraduate career before obtaining her PhD in organic chemistry from University of Pennsylvania. So she applied to radiation oncology residency last year, and she did 2 away rotations, one at MD Anderson, which is where I met her. And as Dr. Corbin was saying, we've become lifelong friends now. And she recently matched at Stanford for radiation oncology residency. And so she is going to give her tips and thoughts from the perspective of a recent medical student applicant. So Dr. Matsui, take the floor.
Great. Thank you so much, Stephanie. Let's see. So here are my slides. So my first piece of advice is reach out to rising PGY1s, PGY2s, just to see what their thoughts are. Like I absolutely did that. And a lot of all this advice comes from them. And then also finding resources just to orient yourself to the field. So as a medical student, it was very overwhelming because I didn't have any rotations during third year. I really didn't know the field of radiation oncology. So I thought that this was a very good article written by people at Penn that was just a primer for medical students. And they talk about nomenclature, like what is the difference between curative and palliative radiation, or like what's a GTV, a PTV. So it's a really short manuscript. I would really recommend giving it a read. And then another resource that was super helpful for me was Roxig's Introduction to Radiation Oncology. On this website, they have 3 different seminars. I only watched the first one, but I think there's like Rad Bio seminars as well. And it just gives you a blueprint for what does a day-to-day life in clinic look like from consult to follow-up, and then also tips for just getting a good HPI. And then here are some helpful references that I found. So the Essentials of Clinical Radiation Oncology. This is a book that I saw a lot of residents at my home institution carry around with them. So I kind of went along and bought it off Amazon. It's like a 500-page book. So it's really good if you want to delve deep into a specific disease site, but it can be very overwhelming. So what I really liked was a pocket book from MD Anderson. It's like a small little book that can fit in your pocket. And it's really good if you have to change disease sites like within a week, because it gives you a very short snapshot of what are the treatment recommendations for certain pathologies. And since it's written by MD Anderson faculty, there are certain things that are very MD Anderson specific, but they do make sure to point out like, this is the way we do it at MD Anderson, but this is how like our TOG expects you to treat patients. And I just want to briefly highlight other references. This is a free one. So the NCCN guidelines is something that I found relatively later. I didn't realize that medical students can actually create an account and log in and look up different disease sites. So before I was like asking residents, can you send me like something on CNS? But you can actually create your account as a medical student and look at like AML and see when is radiation indicated. And then for other disease sites, you can say like when is surgery indicated or systemic therapies. And then not only does it tell you when radiation is indicated, it also tells you like what are the treatment volumes and what are the doses that you usually give. And just one more, there's also clinicaltrials.gov. So when you're rotating at a place like MD Anderson, they have a ton of trials open. So you can look up like glioblastoma, and there are a few trials that are open. So you can use these when you talk to the faculty that you're working with, like, would this trial be appropriate for this patient? So this is more advice like when you get to your away rotation. So my advice would be take the first few days just to orient yourself, because you're in a brand new city. You're mostly likely in a brand new state. So just give yourself grace, because you need to not only get used to the location, but you also have to orient yourself to Epic, like getting access. So don't get overwhelmed. And then also ask residents for advice, because each institution is very different in the way that they approach consults, for example. So you can ask like, is there a way that this attending likes to treat patients, talk to patients? And then also the first few days, learn from the attending. So when there's a consult, I actually went into the room with the attending just to see like how they talk to the patients. And then after the first few days, then you can start really getting into prepping for consult. So I'd spend the day before like looking up more information about the disease site, looking through the patient's history, really coming up with like a draft of the note that I would give to the faculty member. And then on the day of the consult, really spend time with patients, because I found this very exciting. Like this is an opportunity where you really get to take time to go into the room, meet the patients, meet the family, This is the most difficult time in their entire life. And I felt like radiation oncology is one of the few specialties where you really get to take the time to talk with the patients and get to know them as people. So outside of clinic, this is mirroring a lot of what Dr. Corbin said, but really use this opportunity to network. So reach out to faculty. So personally, I was interested in the Holman pathway. So when I was at Stanford, I reached out to like Dr. Moding, Dr. Dean. And then when I was at MD Anderson, I reached out to Dr. Taniguchi. And this is kind of intimidating for med students because you assume that these faculty are super busy, don't have the time to talk to med students. But like when I was at MD Anderson, Dr. Taniguchi spent over an hour of his time talking about advice in terms of applying to residency and beyond. And then also meet with residents outside of clinic. I feel like to get to really know the culture, you have to talk to the residents, ask them the hard-hitting questions. I feel like they can be very candid outside of clinic. And places like MD Anderson actually have a mentor program where before you even step foot into Houston, they pair you with a resident mentor so you can ask those questions. But a lot of the times it's not set up like that. So don't be afraid to just reach out to residents that you really click with and ask them for advice. And also get to know the area. This has been said by Dr. Murphy and Dr. Corbin. So when I was at Stanford, I went to Santa Cruz. And when I was in Houston, I went to Galveston. So really get to know the area, like the fun aspects, but also the areas that you might be living in. I have a 2-year-old daughter, so it was very important to know that these neighborhoods would be appropriate for my family. And this is advice that pretty much mirrors everything Dr. Corbin said. So be enthusiastic every day. It should be very easy because this is a specialty that you want to go into, presumably. Be a great team player. Rad-onc is such a small field, and that's what I personally love about it. The residents become your family. Engage when you can. So as Dr. Corbin mentioned, their didactics. So even though you might be wrong, if there's an opportunity to engage, don't be afraid to, I would say. And also don't be afraid to ask for feedback from residents and attendings. Again, I felt like residents and attendings were very busy, but I still made the effort to say, what are some things that I can improve on? And they were more than happy to give that feedback. So Stephanie asked me to talk about some surprises during my away rotations. So the first surprise was you get preferences before you start your rotation. So for like MD Anderson, I was asked, what disease sites are you interested in? I said CNS and peds and sarcoma. And so they gave me those options to rotate while I was there. And then in terms of culture, this was also very surprising for me. So I had my home rotation, I had Stanford, I had MD Anderson, and the cultures at every institution were very different when it came to like the dynamics between the residents or the dynamics between residents and faculty. So just make note of that. And the end of rotation talks. So Dr. Corbin also mentioned that Mayo does the end of rotation talk. It was somewhat of a surprise to me. So at the end of the rotation, it could be anything from a research topic that you find interesting or research that you've done yourself, or it could be a case presentation on an interesting patient that you saw during your rotation. And then the last surprise was cost. So there's like the financial aspect of it. Dr. Murphy mentioned that you don't necessarily need to do a ton of away rotations, so you can balance that. I don't think there's anything wrong with doing one away rotation because it is very expensive. And there's also the personal cost. So on one rotation, I had to be away from my daughter for 4 weeks, and that was really difficult. So it's another factor that comes into play. And then things that I would do differently. So I would have changed my personal expectations of myself. So for example, like I was on a CNS rotation and I didn't remember what this trial was comparing, and I was really hard on myself. I was like, I should have known that. But as Dr. Corbin mentioned, you're just expected to be enthusiastic and willing to learn. You don't always have to be right. Another thing I would do differently is get to know the program directors. In retrospect, I should have sought out opportunities to talk to them. I did get to know the program coordinators very well, which I do think is very important, but the program directors are another person in the department that are really going to make a difference during your residency. So I would recommend just grabbing coffee with them or even working with them in clinic if you can. And then the last thing that I would have done differently is live close to the hospital. So I was in a tight financial situation. So I specifically looked at programs that were close to family. So I was like living on my brother's floor in San Jose, and I had to drive 30 minutes every single morning. So I would definitely live closer to campus because traffic can be bad in certain cities. So I would just definitely keep that in mind. And here is my contact info for anyone that has questions later on. I'd be more than happy to chat later.
Excellent. Thank you so much, Dr. Matsui. And you were very brave when I asked you that oropharynx Jeopardy question during your rotation, and you got it right. But, it's good to show the enthusiasm and the participation. We always love that as residents, and the faculty love it even more than we do. So thank you for all of that excellent feedback. Okay. Well, we have a ton of medical students on this call. Why don't we take maybe 5 minutes if there are any kind of additional comments? I know Dr. Corbin, you mentioned you want to talk about signaling for a minute, and then we'll use the last 15 minutes or so for med students to ask questions. So if there's any kind of commentary or discussion that Dr. Murphy, Dr. Matsui, and Dr. Corbin want to have, we'll do that for about 5 minutes, and then we'll take questions for the last 15 minutes or so.
Yeah, I don't have too much to add about signaling, except for I think we're all sort of interested to see how it's going to influence the application season and evaluation for applicants and for programs. So we as a program, we've been, or as a field, we've been kind of out of this the last couple of years. So as Jim mentioned, there's data from other specialties, but the use of programs and, or signals and tiered signals and number of signals varies so much. I think I'm just like, how are we going to interpret this information? What we've been kind of told as, the Association of Program Directors and so forth is in giving advice to students, it's really to use the signals to express your genuine interest and to not try to game the system and so forth. But, I think anytime something new is introduced to the applications, it's always going to take a couple of years to know how it influences things. I was super excited to hear that they're adding back the hobbies section of the application. That's one of my favorite things. So we do we divide up in teams and do a holistic review of our application. So I read them, through and through. And sometimes the thing that keeps me sort of really hooked in is trying to figure out who is this person. And I love that section to be able to kind of put it into context.
It was really funny when they stripped the comments from ERIS, like students still put them in ERIS. They would put them in just different sections that for that 1 year. I'm super happy they're going to put that back. I would agree. That's like one of those intangible sections that a lot of people really pay a lot of attention to. I'm embarrassed to say that you guys go to medical school, you do all these wonderful things, but part of it is we're just trying to get to know who you are. And so feel free to express yourself within those hobby section. Yeah, a couple of other, thoughts and comments about program signaling. With specialties that are kind of similar to radiation oncology and competitiveness that have used like anywhere from 2, 3, 4 signals haven't been like mission critical to the process compared to other specialties like orthopedic surgery, neurosurgery, where there's 25 signals. You have to be really sure where you're placing those signals. And if you don't play that game well, you're not going to match. And so we're not like this. So we're certainly in radiation oncology. It's like the stakes are going to be much lower in terms of where you use those signals. But I think, what we've observed and what other institutions have observed is that you do need to be thoughtful about where you're placing those, and that it's not a guarantee that you're going to get an interview, but it's certainly going to increase the probability you're going to get interviews. There are going to be some programs that are only going to interview people that are going to use signals, but a lot of them aren't going to do that. And you have no way as an applicant of knowing whether that's true or not when you're using your signals. Also, I think the one thing to keep in mind is that there are going to be a certain cluster of programs that are going to have a ton of signals, and they can't interview everybody. And so just using your signal doesn't mean you're going to get an interview at that program. It's still going to be a perhaps a pretty heavy lift. And so be thoughtful about using those signals. But again, if just following the lead for other specialties, it's probably not going to really rock the boat too much in radiation oncology. At least that's my prediction. If I'm wrong, you can come and find me and send me a nasty email, say, Dr. Murphy, you're totally wrong. But those are my 2 cents there.
On a similar but slightly different topic, because I had many med students ask me last year what to do with the geographic preference.
Yep.
But I didn't have that, so I had no idea how to advise them. But any thoughts on how that influenced aspect?
So
You mentioned it when you were
I collected information for every UCSD graduate about where they ended up getting an interview, and I know exactly where they apply for residency. I get all that information from Eris. And if your program signaling increase your odds of getting an interview at a given institution across all specialties, the odds ratio was like a 7, which is really profound. It's like the most important thing you could do to actually get an interview at an institution. Program signaling, the odds ratio is around 2. And so it was much more muted in terms of the overall impact. There was a little bit of variability across specialty, but the oomph that geographic signal plays is much less important. It seemed to be a little bit more important in the primary care specialties as opposed to the true, like, especially the surgical subspecialties. There's a little bit more flexibility there. Again, where things fall in radiation oncology, it's really hard to predict. But when we looked at other specialties, those are the patterns that we saw.
Thank you, Dr. Murphy. Okay, we have about 15 minutes left, so let's open the floor to questions from medical students. You can either unmute yourself, put them in the chat. If you don't want it in the chat directly, you can directly message it to me and I'll read it out loud without saying any names. But thank you to Dr. Murphy, Dr. Corbin, Dr. Matsui for all of their insight, and they're now available to answer any questions you have about upcoming away rotations or probably upcoming application cycle either. Okay, Rachel, do you have a question?
Sure. Thank you so much to the panel for speaking. So I'm applying from a med school that doesn't have radiation oncology. So I kind of feel like I'm going in blind. But I unfortunately do have away rotations lined up. But that being said, in relation still to the signaling, do you feel that if away rotation goes really well, a student really enjoys it, is it then expected to use that signal for that away rotation? Or do you feel that if an away rotation went really well, the signal should then be used for a different program that's also of really strong interest?
Kimberly, you're a program director currently. I might let you answer that. I have a couple of thoughts, but I'm really interested to hear what other people think.
Yeah, I'm super curious what you think. I think, you know, that you and the program director and the program will likely have had a chance to kind of talk about the experience and you to express your interest. From my perspective, like I wouldn't consider it a red flag if a student that came, invested a whole month with me, had a great rotation, did not use a program signal. I wouldn't sort of say like, oh, Rachel came here, we loved her, she seemed to have a great experience, but she didn't signal me, I'm not going to interview her. I mean, I don't think that would be the case at all. So I guess even though I think that the party line is to use the signals to express your genuine interest, I think the process of having gone to an away rotation and invested that time is expressing the interest. And I would personally probably save the signal for a different program.
This has been kind of a question that's come up the past couple of years in other specialties, and it's a really sticky one. It's a really, really good question. I think if you are in an opportunity where you can ask what the expectations are for signaling at the program that you're rotating at, that's a good thing. Though there are a lot of times where students don't feel comfortable asking that question. And I totally get the dynamics that play here. If you are really sincerely interested in that program, though, I think it's okay to say, like, I'm actually really sincerely interested in this program. Do I need to use the signal here to really express my interest? And you can get a sense of whether it's important. The signals are really quite valuable. And, every institution is treating these very differently. Here at UCSD, we realize these are extremely valuable. So we don't have our own students use their signals at their home program. Like, we don't expect that because we want them to use that elsewhere. We're just going to assume that they want to come here, whether that's true or not. I don't really know or care. But Other programs aren't like that. Other institutions aren't like that. So there's a lot of heterogeneity about how you use these signals at both away rotations and at a home program. I think if there's ever a doubt, I would probably lean to the side and use the signal. Like, you don't want to hurt yourself inadvertently, especially if you're really quite interested in that program. But you know, I mean, Rachel, you brought up a really good point about, you know, coming from an outside institution, it's certainly going to be a different game. But, you know, getting out there, doing those rotations, we've had a ton of residents and I have a ton of colleagues that came from institutions where there aren't programs. There's clearly a path forward where you can make this work.
Great. Thank you so much.
Yeah, one of our current residents came from had no home program, and actually just the tenacity that it took to set up the rotations and what he was able to accomplish was something that we really thought about too in evaluating the application. So
Wonderful. Thank you all so much. I see Nasitha has her hand up, so we'll let her ask her question next.
Hi, thank you to all the panelists. I liked how Dr. Murphy had the goals of our rotation, and one of my goals is hopefully to get a recommendation letter from the OA rotation. And I was wondering if you had any tips or strategies on how I could best make sure I do that, because a lot of times, especially when there's busy clinic schedules, it's hard to find like the right moment and know who might be the right person to ask for that.
So this is something I thought about a lot, and I asked advice from other residents in the programs as well. So a lot of schools have a composite letter where all the people who you worked with during a rotation will say nice things about you, and then the program director or associate program director will put it all in one letter. So you pretty much have one of those in your back pocket, and then another letter writer that I had, like while I was at Stanford, was a physician scientist that I really got along with, worked really well with in clinic. And then at the end of my time with him, then I just brought it up and he was like, yes, of course, I'd be very happy to do it. So I would say keep in mind the composite letter. And then also, if you get along really well with somebody, then that's definitely a great option as well.
Thank you. Knowing about that composite letter helps a lot. Thanks.
I am not a panelist on this, but I would also say to tell the residents that you're working with, if you're working with the resident, that you hope to get a letter. A lot of times then, you know, since you have that extra goal, we'll try to help like tee things up or have you work with an attending that, you know, classically writes good letters, you know, so we want your success as well, especially if you're enthusiastic and being a great team player. So tell your resident also.
Thank you.
I would just add that it's sort of an expectation. I mean, we understand that people, when they do away rotations, are looking for letters. So don't feel too bashful about kind of seeking that out, because it's part of the general objectives of a rotation usually. We're used to that.
Thanks.
Okay, I'm going to do one question from the chat before we get to Brianna's question. So we had a question on, and Dr. Murphy mentioned this a little bit earlier. So if a student from the Midwest did an away rotation at an institution in California, does that signal at all that they're, well, without signaling, does that show an interest in West Coast programs when you're then evaluating their application if they did not rotate at your specific institution?
You know, before maybe answering that, I'm kind of curious. I mean, I'm in a different location in California. Like, Kimberly, I guess how much do you consider geography when you're looking at your students? And I don't want to ask you to share your trade secrets for selection, but, and you mentioned you had a holistic approach, but is that a factor you guys consider, like where the students are from?
Yeah, you know,
even to go.
yeah, I think it's hard to not look at those sorts of things and consider it. I think, you know, we want to pick people that we think would want to train here and be happy here. And there ends up being, you know, some limited number of interview spots, and you get to a point where you might have two candidates who are both, you know, great people that you'd like to interview, and you might look at one and say, well, this person seems they've done all of their training, you know, on the East Coast. They did everything on the East Coast. Are they as likely to come here as somebody who might have done something kind of closer to where we are, or have demonstrated some geographic variability? So I think it it is kind of one of those things that is sort of like unmeasured, but might factor in a little bit. I don't know, is that your perspective also?
I think so. I think it's really hard not to look at that. I mean, we want to be open and objective and absolutely choose the best residents that we can, but at the same point, you know, as a program, you want to choose people that you think you have a chance of. And like you said, if it's a really strong student in a different region of the country that's never been to your region of the country, it's hard to imagine somebody going from like the East Coast to San Diego, or even the Midwest to San Diego. Like San Diego's not a bad place to live, but again, it's hard to imagine that we're going to really be successful in recruiting that person. There's like clear regional bias with all these, like with interview offers and match and all those sorts of things. And I mean, I think this is probably where that, again, I don't know the answer to that question. Like, I think a program signal would be really powerful. We had somebody from the Midwest and they used a program signal at UCSD and they were a good applicant. We would interview them. Like, I'm pretty sure we would interview them. We're not going to let that stand in the way. But, you know, before signaling, I don't know if we would have offered that person an interview. If they did an away rotation, that would probably help push us as well. But again, with signals, you can kind of get away from that. I don't know how this is all going to play out. It's going to be really fascinating. I mean, I've been saying this for a couple of years. We're all kind of like living this natural experiment with signaling. And I mean, I do feel for the students, you guys are kind of going through this. In general, I think a lot of the patterns that we're seeing administratively are similar, but it's definitely shaping some things on the ground a little bit. So I do feel for our students that are going through this.
In the pre-signaling era, I would occasionally get emails from medical students to just kind of alert us to, like, you know, a geographic connection that might not be present on their application, or, you know, boy, I'm interested in this, or other things. But you know, it's hard to know exactly how this year will play out. So I'm excited to go through it.
I will say, as a girl from the Midwest who did most of my training in the South, whenever I interviewed at a New York City program, no one knows that my in-laws are from New York, but everyone said or asked me every single New York interview, have you ever even been to New York? So, you know, if you have a connection, just like Dr. Corbin mentioned, that gives you a strong tie to that area, I think emailing it would be very, very helpful, so you don't have that kind of question like I did when I interviewed. Okay. All right. Brianna, you're up.
I'm a third year student at an osteopathic school, and I was wondering what you guys think about the USMLE versus like STEP, if we needed to take STEP 2 particularly, or if there was any other like red flags that you would consider on an application.
Jim, I feel like you probably have more data to address this.
Yeah,
Or
I mean, we force our students to take step 2 before they go into the match. And so it's not a question here. Everybody has step 2 before they go into the match. So I don't have that specifically at UCSD. I mean, we absolutely, I mean, when I was a program director a few years ago, I'm sure Kimberly, you have the same thing. We do get some students that don't have step scores, but, you know, be completely honest, we've never put a lot of weight into step. We've never felt that's been a really good indicator. So that's a part of the application we've never really looked too strongly at. That's our own bias, but I don't know, Kimberly, what are your thoughts?
Yeah, we
Curious.
don't, you know, we don't employ any kind of like cutoff or anything like that. And I would say that at least if I recall this right, and Jim, you could probably correct me if I'm representing the data incorrectly, but I don't think there's a strong correlation between like STEP score and success in residency, which I think most program directors and people in education are aware of. And so I guess the potential downside of not having your STEP is that people will be less familiar with the complex, and there might be programs that don't look at your application as seriously if you don't have it. And so, you know, if financially and mentally you're prepared to go through that test as well, you might end up in a better position just because you'll get sort of more views and potentially, you know, more access to other interviews that you might not have otherwise.
You know, I guess just for a big picture in terms of thinking about STEP, when we looked at all predictors of whether students got interviews from our institution, STEP actually wasn't a significant predictor, which was fascinating. We had like, you know, 8,000 data points in this modeling we did. Step 2 score wasn't a significant predictor. For us, our clerkship grades were the most important thing. We kind of have a more classic model. We have like a third of our students get passed, a third get near honors, and a third get honors. So we have kind of the classic tiered grading. That turned out to be like one of the more important factors of our own students getting interviews, and STEP turned out to not be that important. Now, there's a correlation between third year grades and STEP. And so part of that is kind of an important caveat to mention. But I mean, I don't know. It's an interesting question about whether or not you would need to take STEP. Probably being completely honest with yourself, if you feel like you've been a strong test taker in the past, I would probably go ahead and take it. It's only going to potentially help you. If standardized tests haven't been your thing, there might be some reason to not go ahead and go down that pathway, because it's going to show up on your transcript. And so you want to just be thoughtful about that process. There are some schools, I'm pretty sure, who are going to use STEP, as they're going to need to see that before they're going to move forward. So it's going to be an interesting dynamic when you really look across the country. But I mean, every year, I don't know what the fraction of people is that don't have step 2 scores, but it's not a zero number. And I'm pretty sure those students are probably matching, because a lot of them are coming from really good schools and have good transcripts otherwise. I don't know, probably rambled a little bit too much there. Hopefully we answered your question, though. It's a good one.
Thank you.
Okay, and if time permitting, if everyone can stay on, I'm going to try to combine 2 questions into one that we received in the chat. So one question is for people that are not rising 4th year medical students, but that will be applying in the future. Besides location, which everyone alluded to, of getting to know the city, what are some other factors of radiation oncology programs that they should pay attention to when they're selecting or narrowing down away rotations? And then kind of a piggyback off of that, is there any specific or different advice you would have for IMGs applying for away rotations?
Yeah, these are great questions. I think I guess I'll tackle the first part of that. What other things to look for? I think you might want to look for programs that have particular strengths and areas that you're interested in. So there are certain programs that maybe see more pediatric. That's when I talk with medical students who are applying in radiation oncology. Most of them don't have kind of real strong sense for what their career trajectory will look like yet. Some of them have started to think about it, and the ones that tend to have a sense for that are the ones who think that they might want to have a pediatric interest. So that would be something to think about. And the other thing would be the students who have a strong interest in incorporating research into their career, like physician scientists. So understanding what a program might offer in terms of structure for research. Do they support a Holman pathway? Do they not? Who's been successful there, and other things are things that I would think about in selecting away rotations if I were looking towards those things. Modality is something, are you interested in a lot of procedures? Is it a place that does a lot of brachytherapy? Do they have particle therapy? Kind of those types of things. I don't know, Jim, what would you say about that?
I think your answer is really spot on. I don't know if I have really much to add. I've been kind of thinking about the IMG question. I think that's a complicated one. I wish this weren't the case, but there are going to be certain barriers for IMGs who are applying to the system that's just reality. And I do think that in a way, rotation, if you have the means, is potentially a really good way to get your foot in the door. And I think just thinking through the process and the IMGs that I've worked with, and definitely the different subspecialties, not so much like the really, really big primary care specialties, but the different subspecialties, it seems to be just like a really effective way to get your foot in the door, and being, again, really thoughtful about where you're going, making sure that you're aligned with that institution, you're aligned with that city, and there's a realistic chance you think you could match there is going to be an important part of that process. And that there's no probably secret formula behind the scenes that you can use to apply to really measure whether you're aligned with that program, but it's a tricky one. I don't know if other people have other thoughts about IMGs, about how to optimize that route. I'm guessing silence means no. It's a hard one. It's a hard one to answer.
If we have time for one more question, we'll take the last one from Chang Su. Oh, Chang, you're muted. Unmute yourself.
So sorry. Hi. everyone. Thank you so much for spending your valuable time and sharing all these really great advice with us. I'm a MD PhD student from Duke, and so I would love to be involved in research during residency and potentially doing the Holman's pathway. And I just kind of want to ask for your advice, like during your away rotations, like how did you explore kind of research resources and labs at the institution while doing a great job during your clinical time? Thank you.
So I did a lot of my research into the program before I stepped foot into the hospital. So like for Stanford, I looked up different physician scientists in the department, looked at their research. Is this something that I'm interested in? And then while I was there, I actually reached out to the attendings who were running labs, and they were more than happy to have coffee, talk one-on-one. And then I also talked to people who were pursuing the Holman pathway, so residents, because they had so much advice because they were going through like the process of applying for the Holman pathway. So I think talking to attendings and residents is super valuable, like while you're there.
Thank you.
I would caution you from trying to do research while you're on your away rotation, though.
Oh, yes, yeah, not.
Yeah.
Definitely not.
Even clinical projects, right? Your priority is doing
Yeah.
a good job in the clinic. But I've seen that. So, and I haven't even been a resident that long. Maybe I haven't, but yeah. Okay. Well, Dr. Murphy, Dr. Corbin, Dr. Matsui, thank you for your time. Thank you for staying a little later past our time. And thank you to all of the med students that joined. We had a really wonderful turnout for our last part of this ACRO webinar series for med students. So thank you, everyone. And we look forward to meeting you in person during your away rotations and at future conferences. So thank you all.
Thank you.
Thanks, everyone.